Greetings all. This week we're talking about a part of the HIPAA Privacy Rule called the minimum necessary standard. If you get a chance, visit our YouTube channel to subscribe to this series. There's much more to come. More about that later, but for now, let's get to our lesson. Minimum necessary is arguably the heart and soul of the HIPAA Privacy Rule. The minimum necessary standard generally requires practices to take reasonable steps to limit the use, disclosure, and requests for protected health information to the minimum necessary to accomplish the intended purpose. The term reasonable really leaves things open to interpretation. The HHS website says that minimum necessary relies on the professionalism of medical practices, practitioners, and their staffs to decide what information is reasonable to share. Sharing personal health information, or PHI, must be necessary for one of the following three things. Obviously, healthcare workers will need to share information to treat an individual. For example, a provider will share information with a nurse so he or she can provide care. Sharing information for payment purposes is okay. Practices are required to provide information to insurance companies, for example. Lastly, it's okay to share information for healthcare operations, or in other words, to run your business. For example, a practice might share medical information with a transcriptionist who is a business associate of the practice. Here's just a few areas a practice can focus on to make sure minimum necessary is followed. Write policies and procedures that lay out expectations for your staff. You might include guidance that a healthcare worker may not view a patient's record unless they're involved in patient treatment, and then only if they have a need to know. Another policy might require that access to electronic healthcare records must be managed so that only those with a need to know have access. Practices are also required to have a sanction policy that outlines actions that might be taken against an employee if they violate patient privacy. Next, train your staff. It's great to have policies, but they only work if you communicate them to your staff. Present your policies to the team and make sure they have a solid understanding of patient privacy. Minimum necessary, as well as all patient privacy matters, is a top-to-bottom effort. If staff see practitioners and management take care with patient information, they'll be more likely to do the same. Managers and peers should be encouraged to point out anytime someone strays off the privacy path. Lead by example and make patient privacy a core value in your practice's culture. Minimum necessary does not apply to disclosures or requests by a healthcare provider for treatment purposes. It doesn't apply to disclosures to the patient. It doesn't apply to disclosures the patient has authorized. It doesn't apply to disclosures required by law, for example, in cases of domestic abuse. And it does not apply to disclosures for privacy rule enforcement purposes, such as a HIPAA audit or investigation. So here's a real-world example of a minimum necessary violation. A healthcare worker did not observe minimum necessary requirements when she left a telephone message with the daughter of a patient that detailed both the patient's medical condition and treatment plan. The worker likely had no intent to purposely violate patient privacy, but things still went wrong. Here's a few things to consider. What could the practice have done to prevent this? And what could the worker have done to prevent this? In another case, an investigation confirmed allegations that a dental practice flagged some of its medical records with a red sticker with the word AIDS on the outside cover, and that the records were handled so that other patients and staff, without need to know, could read the sticker. As in case study number 1, there was no ill intent, but privacy was still violated. Look around your practice to see if there are any situations where you might better protect patient privacy. Make it a group effort. You might be surprised what you find. To wrap things up, the minimum necessary standard requires we only use, disclose, or request the information needed to treat patients, process payments, and run our business. Protecting patient privacy is a matter of professionalism on everyone's part. And finally, make sure your practice policies reinforce patient privacy. Train your staff on those policies and create a culture where privacy is valued and enforced. You might consider using this lesson along with the case studies in a team meeting or lunch and learn session to train your staff on minimum necessary. Have an honest and open discussion about how your practice can do a great job in protecting patient privacy. Next week, we'll discuss business associates. Business associates are people or companies outside of your staff who can access protected health information from your practice while they perform some service for you. HIPAA regulations put these folks in a special category and require practices take certain actions to make sure both you and your business associates are HIPAA compliant. We'd love to hear from you. If you'd like us to cover specific topics or have questions, just let us know. We'd be happy to help. We want to keep this training free with no advertisements. You can help by subscribing to our YouTube channel today. Just click the YouTube link at the bottom right of the screen, then click the subscribe button. Thank you. Again, my name is Andy Lako of Lake House Consulting, and we'll see you next week.